Good day, people. I still remain Dr. Wahid. Well, this is one of the series that I decided to be doing frequently in order to address so many things as it regards the coronavirus, because we know there are a lot of information that are out there. A lot of people are sharing information, and some are verified, and some are half-truths, and some are not even existent. So that is why I posted a message recently on my Facebook page asking people to tell me some of the questions, because I just want to gauge people's opinion. From some of the messages I got, I'll be reading through some of the messages and I'll be answering the questions as they come. There was something someone asked on Facebook which really sounded funny, but of course it's something that we need to address. It is questions that people usually ask. Someone said, when would coronavirus be said to be over in the world or in our country? There's something I want you to know, that for coronavirus to be declared over, it lies in our hands. It depends on you and I. What are the things that are being campaigned about not to be done? What are the protocols that are being talked about? Washing of hands, wearing of face masks if you need to go out, then maintaining social distancing, sitting in your house if you don't have anything to do out there. Those are the things. If we enforce those things and we're able to follow it through, of course, coronavirus will be a thing of the past. So it lies in our hands for us to say, this is the time that coronavirus will be over. We are the one that will determine that. It depends on how we are able to follow through with the things that have been told to us, the things that have been advised by WHO and other medical bodies for us not to do. So stopping coronavirus or declaring coronavirus as something that is ending, it lies in our hands. Someone asked that, can a person be reinfected after being previously infected with coronavirus? Well, WHO released a statement on the 24th of April, which states that there is no evidence that suggests that when someone has been infected with coronavirus, he wouldn't have a reinfection, or probably if the person have an antibody that prevents against getting a reinfection. Actually, when you're infected, of course there are antibodies, but the antibodies are said to be short-term. That's what research evidence shows, and that is what the researches they suggest, that the antibodies are short-term and have not been proven to prevent someone from getting reinfected. So even in South Korea, there were about 51 people that were previously infected with coronavirus, and they came down again as a result of reinfection with coronavirus. So the evidence we have right now does not suggest that when you have a coronavirus earlier, you can have it again. Someone asked if in Sierraleone we're doing a mass testing or we're planning to do so. Of course, in other nations of the world, these are things that have been suggested, because some people that have done lockdown, even in China, they're doing mass testing of people. But it's something that is in the work for us in the country. It is something that is being talked about, but I don't know how far that discussion has gone, but it's in the work. Someone asks, which one is preferable, hand sanitizer or hand washing? Of course, hand washing every time is preferable over hand sanitization. Why? Hand washing has been proven to kill all kind of germs. Hand sanitizer kills not all type of germs, and even has a limit to the number of viruses it can kill. Hand sanitizer is a good practice, at least for someone to use when you know you're doing some things, like you're in the bank, you're counting money, you need to quickly take your hand sanitizer, wash to use it to clean your hands. But then after that is done, always remember that you need to do your hand washing. Just do hand sanitization. If you've done it for like 5 times, make sure you wash your hands. Hand washing still remains the best, as it kills all kind of germs. Someone asked, what are the common symptoms and signs of COVID-19? They are fever, nasal congestion, runny nose, tiredness, even diarrhea, and chest pain. There are people that presented even at hospital with just generalized weakness. It was asked if it is wise to use gloves when going out. It is not advisable to use gloves when going out. Gloves are for healthcare professionals. Gloves, there are techniques by which you use to put on gloves, and there are techniques by which you use to remove gloves. In the process of putting on a glove, you can infect yourself. In the process of removing a glove, you can also infect yourself. And gloves also gives you a false sense that you're protected, which usually prevents you from washing your hands, and you feel because you've worn a glove, you're well protected. It is not advisable at all Someone asked if we can get COVID-19 from other body fluids apart from the eye, nose, and mouth. Well, what I'll be talking about will be based on research evidence. The virus has been isolated. Isolated means it has been seen and it has been found in upper respiratory tract specimen and lower respiratory tract specimen also. It has also been isolated in some blood culture and some stool culture. However, the duration of stay of the virus in these specimens have not really been established, and the infection from these fluids has also not been established. But of course, they have been found to last for like some few days to several weeks. Someone was asking if COVID is airborne. Well, there are no research evidence to support that COVID is airborne. All we know is that COVID are transmitted via micro droplets, and these droplets are produced when someone sneezes or cough. And these droplets do not last long in the air, they fall down. And that is why they can fall on surfaces and also last long on surfaces whereby someone can touch it. And that's the basis why they said we should always wash our hands regularly. So COVID are transmitted via micro droplets or via aerosol, and there's no evidence to suggest that COVID is airborne. Someone asked how effective are face masks and how should we be using face masks. Anyway, the face mask issue has been something that has generated a lot of discussions. The medical face masks that are used in the hospital, the N95s and the surgical face mask, the N95 have been proven to prevent at least 95% of the virus, because viruses are like 0.3 microns, and these face masks, they prevent such virus having such diameters from coming in. And you also have the N98 mask, which also prevents like 98% of the transmission. However, for cloth masks or the local masks that are being made, it is advisable that the layers are better apposed together for them to be used. A 3-layer mask is suggested, whereby you have 3 layers and it can help to prevent. It is not as if the cloth masks prevent 100% from having prevent you from having COVID, but at least it serves a purpose such that when someone has to go out, you have to use the mask, because the medical masks are being reserved for the healthcare workers, as it is very scarce in worldwide. So it is advisable that when you're using the cloth mask, you have a 3-layer that would also serve a form of protection, not 100%, but at least it will serve a form of protection, and it's not to be used for too long. Then when you're using it, if you want to know the quality of the mask you're using, you can just take a lighter or you get a candle and you try to blow it. If the candle can be blown out, then that mask is not good. If the candle at least still remains or the lighter still remains, then you know that the mask is effective. Somebody was asking, why are people recovering from the virus when there's no vaccine? Of course, I've answered earlier, the immune system is already built by nature to attack any foreign body that comes into the body. You have your immune system that normally fights for you. When you're having fever, it is your body's response to things that is seen, that is coming into your body. When you're having cough, it is your body's protective mechanism. Now, the immune system varies from people to people. Some people have very strong immune system, some have very weak immune system. If your immune system is very strong, of course, it gives you that ability to be able to fend off the virus and get over it on time. Of course, vaccine also does its own, but now in the event where we don't have the vaccine yet, people are fighting it off even with their immune system, and that is why some people even advise that to boost your immune system, you take a lot of fruits and you take a lot of vitamins in order for you to have a very strong immune system to be able to fight the virus. Someone asked, can the virus be transmitted via dead bodies? Well, WHO has proven that dead bodies of COVID-19 patients are not infectious, quoting WHO. Of course, for Ebola, the dead bodies are extremely infectious. For pandemic influenza, of course, the lungs of patients, when improperly handled during autopsy, of course, are infectious. But for COVID-19, the WHO has said the dead bodies are not infectious. However, that doesn't mean it gives us a right to go and be touching bodies or whatever. This is a pandemic. This is something that we have a lot of situations. It is very advisable that one follows the protocol for burying of dead bodies. Somebody asked how long it takes for someone to have the infection and to have recovered from it. Well, the median time of onset from the time of onset to the time of recovery is 2 weeks in people that do not have any underlying medical conditions. But for those that have underlying medical conditions, the median time from the onset to recovery is 3 to 6 weeks. Somebody asked if our health workers are prepared for this fight. Well, there are different types of preparedness. We have mental preparedness. Of course, we are mentally prepared. Emotional preparedness varies. You have, what do I mean by that? You have a doctor who is married to another doctor and they have kids at home and the two of them needs to work. They have a nanny who is no longer coming to their home because of what they have now. So there is emotional distortion in that family. Now, of course, that's why I said it varies. There are some that can handle it emotionally, some cannot handle it emotionally. Then we also look at the financial preparedness. Of course, the financial preparedness is something that is very, very important, because if you are going out, at least you have to be insured and your family needs to be taken care of. So those are areas. We know the financial preparedness is something that is coming up and is still in talks, and we hope that is resolved quickly. And of course, those are areas. And if you're looking at the types of equipment preparedness, of course, it's there. It's something that is also that also varies, and it's not only Sierra Leone alone. Even in the world, people are having shortage of these medical supplies because you're seeing a rise in the number of patients you're seeing normally. So those things are things that are coming and are being addressed part time. Somebody asked, how much disinfectant do I need to drink to prevent COVID? Well, the answer is no. The answer is no. That one, there's no need to talk too much about it. The answer is no. You should not take disinfectant. You should not take Dettol. You should not take Hypo. You should not take bleach. You should not take Clorox. It is deadly and it will kill you. Somebody is asking, where in Freetown is the hotspot and what do I need to do to prevent myself when I'm passing through those places? Now, these are talks that usually cause stigma. When people say hotspot, there's nothing like hotspot. What we know is that coronavirus exists in Freetown, exists in Sierra Leone. You just have to prevent yourself. There's no different kind of prevention when you are going to Congo Town from when you are going to Juba, or when you are going to Ilcourt, or when you are going to Waterloo. Wash your hands. The way you wash your hands in Congo Town is the same way you should wash your hand when you get to Waterloo. The same way you wear face mask if you're coming from Lumley is the same way you should wear your face mask when you're Wilkinson Road. So there's no nothing like hotspots for coronavirus. Coronavirus exists in Sierra Leone, exists in Freetown, and we should prevent it. Someone asked, is it only when an infected person shows symptoms that you can infect others? No. Even those that are asymptomatic can infect others, because even when you're talking, the droplets are coming out. So it's not only when you're coughing. So someone that even has it and is not showing any symptoms can also infect others. Someone asked, can COVID-19 be cured without a ventilator? Yes, 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 and yes. Someone said COVID has no cure. How come the number of people that have recovered have outweighed the number of people that have died? Of course, I've answered this earlier. COVID is a mild disease. You'll even see people that will have COVID without even knowing. They will not even show any symptoms. Majority of the cases, I can tell you, if 10 people have COVID here right now, 9 will survive. And probably you just have one that will pass away. And the one that would pass away will probably be as a result of an underlying medical condition, or the person has underlying immunosuppression, or there's something that is affecting the immune system. So it's not something that is as fatal as Ebola. It is something that is mild. People get over it, and that is why you have a high number of people that are recovered compared to the number of people that have died. It is not like when we have COVID now, it's a death sentence. Someone said, is it true that Sierra Leone is running short of test kits, even when being the first country in Africa that had test kit that was more than every other African country? Well, running short of test kits is something that is happening all over the world. It is not only in Sierra Leone, because you're testing people every day. You're testing people. If you have something like 20,000, you don't expect it to be 20,000 forever. You expect it to be going down, and these are happening, of course. But I think that is being addressed. that is being addressed. There are a lot of supplies. Government are working on the ground. I'm not a spokesperson for the government or the EOC, but at least that is what I am made to know, that government is working on the ground to at least get those things in and improve on what we have already. But it hasn't got into a situation that cannot be handled. That is, of course, the truth. Someone asked, when will government start crediting Sierraleonean accounts for the curfew or the lockdown that is happening? Well, I really don't have any information that suggests that accounts will be credited. I have no information that suggests that government has promised to give Sierraleoneans money and that will be deposited into their account. That is beyond my the scope of this video. Somebody asked, what is the difference between COVID-19 deaths and COVID-19 related deaths? Now, this is how I will explain this. Imagine someone has an hypertension, or somebody that has been having diabetes for a long time and is infected with COVID. And this person is in a treatment center and has an onset of the symptoms that usually happens when he's having or has complications arising from diabetes, and is in the hospital. And this is being managed. The sugar is rising exponentially. It is not the COVID that is affecting the sugar, but because the person already has diabetes and the sugar is rising. And at the end of the day, maybe the person dies as a result of hyperglycemia, that is a high sugar in the body, or the person dies as a result of hypoglycemia, low sugar in the body. That is a COVID-19 related death. It is not that COVID killed the person. What killed the person is the diabetes. Or somebody has hypertension and the blood pressure is rising sporadically. Of course, the blood pressure rising sporadically might end up killing that patient without it being COVID. So that is a COVID-19 related death. Now, COVID death in itself is that death that arises as a result of the complications of COVID. Like someone that has COVID that has been sneezing, having fever, then the person goes into respiratory distress and goes into what we call acute respiratory distress, such that the person can find it hard to breathe at the end of the day, and the person is not able to come out of it. And you see that the COVID has succeeded in affecting such patient. Then that is a pure COVID death. But COVID-19 related deaths are deaths that occur as a result of other underlying conditions before the COVID infection. Someone asks, are all these cases that we're having in Sierra Leone coming from quarantine homes? No. There are cases that are coming from quarantine homes. There are cases that have been seen that don't even have contact, that have never had any history of travel, that has no history of having recent contact with someone that has COVID. So we've been having different kind of cases. So you can see, I think we're having right now what we call community transmission, because most of the cases we're seeing have no link with the established cases that are known. So all are not coming from quarantine. You have some just coming from the streets, or just coming from someone that has cold and presented at the hospital and a test was done and the person is COVID positive. Thank you so very much for listening. I hope I've been able to at least answer some of your questions. I know I might not have been able to do justice 100%, but I believe this is a first step. Let's start and keep the questions coming, things that we don't know. It's better we talk about it rather than we allow people to go with the myths and they spread it, because information is something that is very key in this fight. It is very important that we know the truth. As they said, ye shall know the truth, and the truth shall set us free. So we're trying as much as possible to bring this closer to people. Let's discuss it and let's talk about it. There will be a Creole version coming very soon, and I really want to thank you for listening. Thank you.